Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I want to just say I hope you are doing well. And many of us in the U.S. are moving into the phase where dental practices can see patients for non-emergency care. And in many practices, that means that the hygienists are moving back into the practice and coming back into care for patients. And so one question that's come up for us a lot is, what about ultrasonics? Should I be using ultrasonics right now? What do I do if I can't use ultrasonics? All these questions are kind of swirling about right now, and they're really good ones. And so our advice has been, first, you must follow whatever is the guidance coming from your state dental board especially. And in all states, it's going to be a little bit different. Some states are leaving it open to the judgment of the clinician, and some states are very specifically stating no ultrasonic use at this time, right? So if you have no ultrasonic use at this time, then we have to decide what is in our patient's best interest, and are we able to hand scale and do some polishing, whether that is polishing with a rubber cup, whether that is polishing with a toothbrush and doing some very intensive oral hygiene instructions and that kind of thing, and perhaps doing some irrigating and some of those other things to possibly, reduce some of the biofilm that's there. Some biofilm reduction is better than no biofilm reduction. And then if your state leaves it open for judgment, then I think you have a couple other things to look for. One is, do you have the proper PPE in place and equipment, high volume evacuation, to control the aerosols? And so that is certainly a discussion that you'll want to have with your team and with your dentist and hygienist together. And so if you do have those things in place and you feel comfortable, then it's important that the whole team understand that the hygienist may make decisions based on a case-by-case basis, right, with each patient, depending on what that patient needs, what is most appropriate for that patient in disrupting the biofilm. And is it possible to do maybe that in some isolated areas, some site-specific areas that really perhaps have the most deposit, maybe need the most biofilm disruption in those areas, perhaps if there is some periotherapy happening. All of those are decisions that really need to be made by the clinician and the hygienist and the dentist working together to decide what they're comfortable with. We're seeing all kinds of different things across the board with our clients. Some are opening for restorative treatment first, and then hygiene's coming a little bit later. Perhaps they're coming in with a soft opening with part of the team, and another part of the team is coming a week or two later. Some are extending appointments a bit just to accommodate some of the conversations and the time it's going to take to just get the PPE system down, for a couple weeks. And so there are a lot of things happening. So our default is always looking at the guidelines that are coming from your state specifically. If those leave it up to your judgment, then just making sure that you have the things in place that you feel like you can safely treat these patients with ultrasonics, and then making that decision on a case-by-case basis. So I hope that you all are well, and that we are all going to come through this stronger. We're going to learn a lot, and we just have to stick together and keep communicating and take care. We love your feedback.